Welcome to the Mug Hub podcast, the ultimate platform for all things related to medicine's use, patient care, and the incredible world of pharmacy. We are your hosts, Connor and Sian, and we're thrilled to have you join us today.
Here at the Mug Hub podcast, we're passionate about empowering future pharmacists, expanding your knowledge and igniting your curiosity. Whether you're a first year embarking on your pharmacy journey or a final year getting ready to go out into practice, this podcast is designed just for you.
Across our series, we delve into 4 captivating themes that will take you on an enlightening and entertaining journey. From exploring intriguing clinical topics to showcasing the extraordinary individuals who make up our incredible teams, we're here to unlock the secrets of the pharmacy world.
So grab your favourite mug, settle in, and let's embark on an incredible voyage together. Get ready to be inspired, educated, and motivated as we unlock the vast potential of pharmacy and the vital role it plays in healthcare.
Welcome back to another episode of the Mug Hub podcast. We have a very special guest for the second time on this podcast, Minna Eii, this time talking about all things sustainability. So thank you, Minna, for coming back on the podcast. I wonder if you could just give us a little bit of a heads up on sustainability. So your face is everywhere at the moment from a sustainability standpoint. What is sustainability and how can our pharmacy students get involved in that?
Oh, yeah, sure. My favourite subject. So I would want to start with some statistics, first of all. So NHS England's come out with this report. The Greener NHS team said that in 2019, 25% of NHS is carbon footprint is made up of pharmaceuticals, inhalers, anaesthetic gases. Wow. So now I've always been told that whenever medicines are involved, the pharmacy team should be involved. How can we resolve this? And sustainable healthcare is something that a lot of people are moving towards at the minute. If you've been paying attention to the climate change agenda, the news, I don't like to call it agenda. Someone called it philosophical belief the other day, as opposed.
What don't you like about agenda? Is it a bit...
It's not an agenda. It's scientific facts that the world is changing. The global warming is real, and there needs to be an urgency to fix this. In the next, with limited time frame, and depending on how the global leaders and the countries and the people act, it could shape, our future into essentially we're sleepwalking into, a climate catastrophe that nobody seems to really pay attention to. But the fair few of us who do, and it's inspire us, if you like, to want to take action. So I mentioned Pharmacy Declares before. So we started looking at where are the carbon hotspots, if you like, and what is the impact of pharmaceuticals and operational pharmacy wise. What aspects of our services delivery that is really, we could make it more leaner, a lower carbon impact. So those are the statistics. And if we want to talk about, potential health impacts, so we're seeing, NHS under pressure so much now. The potential health impacts, for example, in heat waves year on year, there's record-breaking temperature. I'm sure in Brighton you would have experienced that. And, the statistics showed 2 years ago that 90% of hospital wards in England are not, infrastructure-wise adapt to heat like that. So 90% of the wards are at risk of overheating. What does that mean for our patients on the ward? So last year when I was working in a hospital, one of my side room wanted to self-discharge because they cannot handle the heat on the ward. Wow. And this is a patient who was already unwell, frail, and even the fan on the ward can't, make them stay in hospital. So we're faced with those kind of, healthcare decisions of this is an environmental factor that's impacting on a patient's health. There's no medicines that could fix that. So how do we fix this environmental problem? So that's where we're coming from when we talk about environmental factors. And increasingly, air pollution, this is a huge thing at the minute, where there's going to be reports coming out. There's already reports coming out that is linked to dementia. So how do we, in terms of managing or preventing that? So we're coming into public health now. So global public health, this is what, sustainable healthcare essentially is, and sitting with the domain at the minute. We're trying to prevent people from getting ill. We're trying to, mitigate the risk of what comes with climate change impacts. So collectively, this is something that we collectively win or we collectively fail together. There's no small wins or, small losers. It's everyone. It's globally, it's everyone.
Just
a big topic.
Wow, that's massive. So it seems to me like there's two strands to it almost. So you've got the carbon footprint and the sustainability of healthcare itself and pharmacy in particular. So medicines take a lot of ecological resources to produce, to store, to dispose of. So is that one aspect of it? And then the other aspect of is all so global warming and the changes that we're seeing to our environment, what impact that has on our health. Is that right? Am I getting the right kind of understanding?
Yep, absolutely. So this is something that we're trying to try and kind of separate out, if you like. So I've been working on some policy writing with the International Federation of Pharmaceutical, the FIP, if you like, the more well known as. So in, I think, 2016, there's already been a piece of work written about, when people talk about sustainability, they think about waste, they think about recycling, the production, the life cycle approaches to products we use, the overconsumption. But I think that there's more than that. So if you think about, we talked about patient care and, that's shared decision making. So we'll use polypharmacy, for example. So as pharmacy professionals, we're prime, in position to have that conversation with patients. We'll use that patient with the paracetamol example that I found again. So if I found their doorstep box with, lunchtime and tea time paracetamol left in the box, what are they doing with it every week? That's going to landfill. And then what does that impact on when that goes to landfill and then it goes to, mixed with other wastes and it doesn't get processed properly? How does that impact life on land? How does that impact life underwater? So it goes way beyond that. And then having that ability, if you like, to spot that, to have that conversation with patient, to be able to have that empowerment of patient to say, how do you want to manage your care better? Is it should we just leave it twice a day as your carers come, or can we increase anything else that might help with your pain throughout the day? That conversation itself is a green activity because you're encouraging compliance, you're reducing waste and reducing pollution. So it's a complex kind of model of care, if you like, when we talk about sustainable healthcare.
I love that. And I think that's one of the biggest take homes from one of the first talks that I went to was medicines optimization in itself is greener pharmacy. Is one step towards, if you can speak to patients about their medicines, either stop something or have a medicine be taken instead of ending up in landfill, that is you thinking greener about that patient's care.
Yep.
Which for me was a big take home to start with, to think, we're already thinking about this, we're just reframing.
Yes.
Absolutely.
Pharmacists are in a great place, we're already doing it, we're just not talking about it as being something that is linked to.
Oh, absolutely. And, all these services that community pharmacy provides, so, your healthy lifestyle advice, your weight management, your contraceptive advice, your smoking cessation clinics that we offer, all these are preventing, patients from getting ill, needing secondary care, because there's a large carbon footprint attached to hospital admissions, outpatient clinics, and the interaction with healthcare professionals. If community pharmacists and, pharmacy teams can prevent that from happening, they are doing green activities every day to prevent all that need for future healthcare resources.
So at what level do you think it's being looked at within the NHS at the moment? Or is that part of the problem why you've had to put this group together?
Yep, so 3 years ago, there was not a peep about this. So hence we started this movement, this group. And unsurprisingly, a lot of people, it resonates with a lot of people because they've been thinking about along the same lines, but just nobody, kind of know which direction to go to. And increasingly, it's been put on NHS's agenda. So Scotland, Wales have got their decarbonisation plans out to read. It's, hundreds of pages long if you're interested in a bedtime reading. There is increasing, IPCC reports, and there is researchers that are coming out attached to sustainability sustainable healthcare. There's so much evidence now growing exponentially since the pandemic, because I think after the pandemic, people realised that something small happening somewhere can affect globally, that impact of globally. And it's the same with climate change. So, someone producing mass amount of carbon footprint somewhere is not just going to increase the global temperature in that country. It's globally where this affects people everywhere. So I think after the pandemic, people like to call it the green recovery, if you like. So we had COP26, the United Nations Conference of Party 2021 in Glasgow, and that I think put a lot of the climate change in news, if you like, in front of people's mind, and make them rethink how they can change the diet, or change the sustainable practices to be a more good citizen, if you like. It's a global citizen example. So yeah, increasingly in NHS. So the Health and Social Care Act was amended in 2022. It's a legal requirement now for all NHS staff to work towards net zero. So it's not a cherry on top. This is actually mandated in legislation. So there's many ways now in NHS England commissioning pieces of work here and there. What's the carbon footprint of virtual wards? What's the carbon footprint of, outpatient home care delivery pharmacy services? So yeah, there's increasingly getting looked at.
That's interesting. And you're talking about COVID. It raises a little sort of, I don't know, little light in my head. Actually, the environmental impact of all of the PPE products and the single-use masks and the single-use aprons. How does that fit in with it all? Because, you're saying that NHS staff now have a requirement that they've got to be net zero, or and sustainability is a big part of their job now. But also at the same time, I think it's still right that you have to wear a mask in hospital. Is that correct?
So this is another thing that differs in every hospital depending on what's happening locally. So I can speak for my hospital guidances. So if you're coming across a patient that is, we don't suspect COVID infection or any kinds of infection, I don't think the plastic apron or the gloves are required. You can choose to wear a mask if they're coughing, and you're suspecting there's an active infection going on. But I don't think that's even a requirement. So it depends on local infection control policies. It depends on what you're doing. So a good example, I think actually that came up from Brighton University, is a great climate change and health course here. So they looked at using gloves, and a lot of people are using gloves for no reason. They think that gloves protect them from infection, but they're just spreading infection as without gloves.
It's just another surface.
Exactly. So it's kind of thinking, do you really need gloves? So another good example is COVID vaccine clinics. Loads of people are still wearing plastic pinnies and gloves. You do not need that. What are you doing? So there's a lot of waste as a result from that.
I remember going into Specsavers. It must have been between lockdowns, because I could actually go in to choose my glasses, and all of the people working on the shop floor had masks on and had the aprons on, and then I thought, oh boy, they're really being serious here. But I went in to see the optician. He had none of it, no mask, no apron or anything. And I questioned, so what's going on out there? He said, I just think they're worried. He said, I don't think it's absolutely not necessary. I think they're just worried.
Yeah, I think that doesn't help with the lack of official guidance, that permission to say you do not need to wear this. But I think increasingly people are saying that out loud now, and evidenced by research paper, swabs, and say, look, this is not a productive way to work, and doesn't reduce the risk of infection. And we need, this is such an under research area in terms of sustainable healthcare. We need more research. So if any students want to look up in future research in sustainable healthcare, there would be plenty of publication opportunities and collaboration going on.
Yeah, great idea for final year projects.
It's on next week.
It's on your cards?
Oh,
right.
Hopefully
Get
doing
you.
some cross-university collaboration.
Amazing.
Yeah, so I think that's fantastic, and I think, you've mentioned lots of things, but how do you think we could link this to our students? So as an undergraduate student, soon to be pharmacist, what could we be thinking about on a day-to-day basis to be greener?
Yeah, so I would like to think it as it's not an add-on. So it should be embedded within, not just professional life and everyday life, really. It's not being a good citizen. It's not hard not to be wasteful. And do we need to have that disposable cup every time we have our coffee? Can we bring our reusable bottle? Simple things like that. To looking at people's condition and how to help them better. And I think I've given an example of that already. I'm trying to think of another example. Inhalers counselling, that's a good one to talk about. So if people don't know, the pressurized meter dose inhalers contains propellants that has more global warming potential compared to the dry powder inhalers, such as easy inhalers, autohalers. So there is a impact for I want to say IIF, but I think they've been taken off the market now. So GP surgeries, get commissioned for certain things, and one of them was last year was to switch people, if appropriate, to lower carbon inhalers. But that's not the priority from this April onwards. Because obviously with the pressures, they've shifted priorities. So yeah, and in terms of that, how to speak to patients about, the impacts of their inhalers, because you can't start a conversation with, right, we're switching your inhalers now because of climate change and, and this target that we need to meet. So it's approaching them going, how often do you use inhaler and why do you think you need to use your SABA and Ventolin more than 6 times a day? What have you been using your preventer properly? And that exploration, and then in the end go, can we try maybe this dry powder inhaler to see if you agree with it better, with the option to switch back to pressurized meter dose inhaler if you don't agree with it. See that conversation, the language that you use. So a lot of people now are trying to avoid blanket switching. So what that means is, switch them all to low carbon inhaler for the agenda without telling the patient, and that's not shared decision making. So and have patients knowing that they have the option to switch back to the original inhaler that they're comfortable with as well. It's just added layer of that I'm going to try this and see if it works, and if it does, great. If it doesn't, then optimize the care better to see what can we step up from here if you're still exacerbating, needing that much of SABA. So that level of skill itself, coupled up with then tell them you're using less of your SABA Ventolins now, that's actually really good for the planet, because this is saving, I don't know how many, I don't like the car journey example, but having that ability to have that conversation, because there's been public health campaigns increasingly rolled out now. General public actually are more clued up than the clinicians and physicians themselves, sometimes I find.
Really?
In terms of the climate agenda. They see something in the news or they research it themselves, they bring it to the table and go, my tablet is not vegan, I would like to have vegan tablet. Then where do you go for that information? So increasingly I think our clinicians need to be clued up that you might increasingly get asked these questions. Where do you find the answers?
I like the inhaler example, and I think the idea of that you said SABA, so short-acting beta agonists, so your relievers over your preventers, your steroid inhaler. Even that conversation about, are you using your steroid inhaler, that might, if they then are using their steroid inhaler, are less likely to use a blue salbutamol or something. In itself, you're using less of one of the inhalers because they're now actually using the other one.
Yep.
Again, in itself, without even switching to a dry powder, you probably already saved CO2 emissions.
Yeah, and that optimizing respiratory care itself is a green activity. Right? So if you start framing it that way, then you start to see like how your health intervention for your patients are actually also helping the planet.
Yeah, and a conversation that could prevent potentially patients from stockpiling medications. I'm speaking from my own naughty personal experience here with a son who has asthma, but very, very well controlled asthma. Hasn't had, I'm touching wood now, hasn't had an asthma attack in, I don't know, 6 years maybe. Yet I still have to make sure that we've got a good stock of Ventolin inhalers just in case.
What's a good stock? You're not going to tell me
one
that.
here, one there.
I am not going to tell you, but yeah, no,
It's
there
bad.
is an element of that. He needs one in his school bag. There needs to be one at home. There needs to be one in his other house.
Okay, that's 3.
So, yeah, we don't need to add them up. It's fine. It's fine. But they go out of date. Obviously, they go out of date. I'm not going to tell you what I do with them.
We
don't need to know. But, because it's not, this isn't an interview about me and my bad behaviour. So, but that's an example of another area where you could potentially be more sustainable in your day-to-day practice as a pharmacist by having that conversation with patients about what medications are needed and how many are needed in your personal stash.
Oh, absolutely. So another example I always like to use in talks is, say, the chewable calcium example. Increasingly in acute medicine, I find anyway, when you look at, again, looking at a patient holistically, I don't know, say Margaret with dentures and no teeth, and prescribe Adcal chewable D3. I'm going, can she actually chew that? So then you start having conversation, and you kind of get a feel of person sometimes. Well, I think I'm quite a highly sensitive person. So then you get the sense whether the person's, are very comply with what clinicians say. I dare not tell them I'm not compliant. Or they openly tell you you're not taking the tablet. So then you approach a conversation carefully and go, Margaret, I think, these might be hard to chew for you. And, patients tell me they taste like chalk. Do you think you agree with these? Almost giving them a permission to tell them that they're not compliant. So changing the way you consult patients as well and actually explore that compliance issue is a skill. And then 9 times out of 10, patients tell me, oh yeah, I hadn't taken them for the last 3 months for that very reason. And they open up to you. And then you then explore, okay, so there's Adcal caplets. Do you think you can swallow those instead? They don't need chewing, just swallow them like the rest of your tablets and go, yeah, I'd much prefer that. Then you manage their long-term osteoporosis and you prevent them from getting a fracture from fall, all the benefits that comes to come. And you reduce waste from the tablets that they've been chucking out the landfill.
Everyone's a winner.
Exactly. So there's so much in that in terms of how we conduct consultations and our everyday job that can be green activities.
Yeah, brilliant. Thank you.
Wow. Thank you, Minna, for joining us on another episode of the podcast. And you've given us some great insights into the ways that pharmacists and student pharmacists can get involved in more sustainable and greener activities. We could talk for days and weeks about sustainability, and I feel like that you could too as well. So at any point we could bring you back. That would be fantastic. But for now, thank you so much for your time.
And that brings us to the end of another captivating episode of the Mug Hub podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics, introduce you to incredible individuals, and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the Mug Hub podcast.